So, what's new in acne? I divided my talk into several groups. I talked about new therapies, new devices, new concepts, and what's in the future. So, in terms of new topical agents, we have a combination of benzoyl peroxide and tretinoin as a cream, which used to be a combination that you couldn't make happen, right? You couldn't put the two of them together because benzoyl peroxide oxidizes tretinoin. But they found a way to do it by separately encasing the ingredients within a silica shell. So it's very effective, has very low tolerability issues because the actives have to slowly sneak out through the leaves of these silica shells onto the surface of the skin. You don't get a big bolus all at once. So tolerability is much better than you would expect from these two ordinarily concentration-dependent irritants. I talked about the first new triple combination, which is benzoyl peroxide, adapalene, and clindamycin, with unparalleled efficacy and extremely low tolerability issues. It just came out last month, so I think we're all just starting to get to know it, but the phase 3 data was almost too hard to believe in terms of how well it works. 71 and 76% reduction in inflammatory and non-inflammatory lesions. And then clascoterone, which I guess we can still call new, even though it's about 2 years old. Our first new agent in acne for more than 40 years, a androgen receptor inhibitor, and with about a 20% success rate. It takes a little bit of time for it to get started, but an excellent foundational medication. I personally use it in combination with perhaps a topical retinoid to attack the comedonal lesions as well as the inflammatory lesions. New devices, we have the 1726 nanometer laser, which selectively destroys sebaceous glands, does very, very little in terms of off-target damage. Pain threshold is very good and works very nicely in patients of color. In fact, 57% of patients in the study for the one laser were skin type 4 to 6, so highly effective as well as safe for use in darker skin. I talked about controversies in treating transmasculine patients, difficulties in acquiring medications, as well as the use of medications in treating someone that you can't treat, for example, with spironolactone. The use of isotretinoin in that group is particularly helpful. And then finally, what's in the future? Well, I talked about vaccines. I'm not sure if it's ever going to come to fruition. We're at the very, very beginning of it. But we have a vaccine going into phase 2 trials that looks sort of promising. It's not to give to people to prevent acne to begin with. The goal is to give it to people who have, for example, moderate acne, who are on their way to severe, in order to try to stop that. So to stop the severity and perhaps the duration of acne. They seem to be quite safe with very few side effects. So I think we're looking forward to that, and hopefully it will make it all the way to the market.